Hi, my name is Marley Befu, and this is my Sports Med 3 medical research project. I'm doing my project on the research of strokes. What is a stroke? A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. A stroke is a medical emergency and prompt treatment is crucial. Early action can reduce brain damage and other complications. A stroke is also known as a brain bleed. There are 3 types of strokes. There's an ischemic type of stroke, which is when the blood flow through the artery that supplies oxygen-rich blood to the brain gets blocked. There's a hemorrhagic stroke, where an artery in the brain leaks blood or ruptures, which puts too much pressure on the brain cell, causing damage to the brain cell itself. And then there's a transient ischemic attack, also known as a TIA, also known as a mini stroke, where blood flow to the brain is blocked for a short period of time, usually no more than 5 minutes. The signs of a stroke are trouble speaking and understanding what other people are saying, problem seeing in both or one of the eyes, a headache, trouble walking, the one side of the face and arms droop, and if any of this occurs, you must seek medical help. Signs of a stroke can also differ depending on if the patient is a male or female as well. To prevent a stroke from happening or reoccurring, it is important to have a healthy diet, because a healthy diet creates lower blood pressure, which means a lower risk of clotting of the blood. Exercise, which creates healthy blood pressure and lower cholesterol. Avoid smoking, because smoking narrows the arteries, which causes the blood clotting. Avoid alcohol, because alcohol creates high blood pressure and irregular heartbeats. The few treatments for a stroke is digital imagery, medication, clot retrieval devices, and surgery. Depending on which type of stroke the patient has depends on what type of treatment the doctors will give the patient. After a person has a stroke, the effects on the person are memory loss, vision problems, quick or slow behavior, paralysis on either side of the body, depending on which side the stroke was on, as well as depending if the behavior is quick or slow, depending if the stroke was on the left or the right side of the brain. A stroke affects the brainstem, cerebellum, limbic system, cerebrum, and the base of the brain is the most fatal when a stroke occurs, because it is the main function of the brain and of the person themselves. A stroke is a medical emergency where someone has a blood clot in the brain or a brain cell rupture. If anyone ever has any signs of a stroke, such as face, arms, and speech, seek medical help immediately. Exercising and a healthy diet are main factors into preventing strokes. However, strokes can also be genetics. Strokes are most seen in older men and women. During my research, I learned a lot about strokes, the prevention, signs of strokes, and which parts of the brains a stroke does affect. Thank you.